Good afternoon, and welcome to the third session of the Social Security Academy for Interns. Unfiltered, straight talk on Social Security. My name is Daniel Marins, a NASI intern with Social Security Works. Now I'd like to briefly introduce our distinguished panel members. Ethan Pollack is a policy analyst with the Economic Policy Institute. On your left. You're right. Yeah. And Marc Goldwein is the policy director with the Committee for a Responsible Federal Budget, and he's also an alumnus of the best university in the country, I think, Johns Hopkins University. But I'm biased because I went there. So I wanted to go off script for a second. How many people have heard of the National Commission on Fiscal Responsibility and Reform? That's very good. How many have some idea of what it does? I guess probably the same number, similar number, some idea. Well, actually, to add to the bios here, Marc is the Associate Director of the National Commission on Fiscal Responsibility and Reform, and Ethan is the staff economist. So they have a very important role in the way the Commission looks at programs like Social Security in the context of our long-term fiscal outlook. So that should make it all the more interesting. Their full bios can be found in your conference folders. Following the presentations, we will have ample time for the audience to ask questions of the panel. With that, I turn the podium over to Mr. Pollack.
All right, well, thank you so much for being here, and I should just point out initially that neither Marc nor myself are speaking for anything to do with the commission. These are our own opinions. So I want to start by making two basic points. One, we do face a very large fiscal gap where our long-term revenues are insufficient to fund our long-term spending obligations. And Social Security is a very small portion of that. The second is, that said, Social Security is still a problem. And when we're looking for solutions, we need to both consider ones that are economically efficient, do not put an undue burden on low-income households, and are also consistent with the last time that we solved this problem, which was the 1983 Greenspan Commission. So, moving on. This shows the blue line or the blue bar is the fiscal gap in 2020, 2040, 2060, and 2080 under CBO's alternative baseline. The two other bars are two different measures of Social Security's contributions to that deficit in those years. And you can see that Social Security represents only about 16% of the overall fiscal gap in 2020 and 2040, and about 10% and 9% in 2060 and 2080. So not only is it a small portion of the long-run fiscal challenge we face, but is also a declining portion. So in other words, when you hear Social Security put in the context of the overall fiscal gap, remember that it is a very small portion and not one of the main drivers. That said, well, first I should go into what is driving the deficits if it's not Social Security. One word, healthcare, which is actually two words. The blue line is Social Security. Starts at about 4.8% of the economy, rises to about 6.2%. By 2037, and then down and then up again a little bit to end at 6.3% of the economy by 2082. This does not exactly the picture of an unsustainable government program. By contrast, you can look at the red line. That's Medicare, Medicaid, exchange subsidies, and CHIP outlays. That essentially is a civilian, public civilian healthcare spending, and that rises from 5.4 to nearly quadrupling at 20.1% of the economy by in the next 75 years. So, what is causing this this boom? Well, again, this is Social Security and then the healthcare spending. This is actually healthcare reform. Healthcare reform bent the curve a little bit, but the story is still the same. That there's two factors. One is the aging of the population, and the other is excess healthcare cost growth. The aging effect is a larger driver in the near term until about the 2030 or so, but then after that is the excess healthcare cost growth. And you can think about that as healthcare is growing at about 6 to 9% per year, and the economy is not. Even when if it's at full employment, it is growing at much less than that. So, and this is driven mainly by private providers of healthcare, doctors, clinics, hospitals, et cetera, who are charging more. The government essentially pays not for, does not provide the healthcare itself. It just covers the reimbursement. So those are the costs. Those are external costs of the government that are driving government outlays in that regard. So the solution is a healthcare reform. We've done a little bit. We need to do more to bend the cost curve. And I'll skip through that. That said, Social Security is still a problem. It represents about the gap is about either 0.6 to 0.8% of GDP over the next 75 years, which is small, but if we do want to fix it now, then I think one of the ways that we should look at it is what has changed since the last time we fixed it. So the major things, the valuation period, this is pretty simple. Essentially, as I'm sure you guys know, Social Security in 1983, they fixed it so that it was going to start running huge surpluses, and this was to fund the baby boom retirement, and then eventually there would be deficits, and they would build up a trust fund, which is now at about $2.5 trillion, which would then fund the retirement of the baby boomers, which made sense because the baby boomers were in their peak earning period during the time that Social Security surpluses were being created. So as the 75-year valuation window moves, 1 year to the next, you're dropping years of surpluses and adding years of deficits. So that has been a large driver in the degradation of the finances of Social Security. There's two other major factors that I want to talk about. One is demographics, and the other is economic factors. Okay, the demographic factors are the aging of the population. Now you can see aging population actually has improved the balances, and the reason is in part because they already knew that the population was going to be aging by 1983. We knew that the baby boomers, they were already born at that point, so it was not easy to figure out when they were going to be retiring. What they did not think of is that immigration would be as large as it actually was. So the overall Social Security system has benefited heavily from larger than expected immigration. For economic factors, this has little to do with GDP growth and much more to do with the fact that we've had increasing economic inequality over the last couple decades. The next graph shows that here. You have the middle 60% and the bottom 20%, the very bottom, and then the top 1% you see is a huge spike in their household income since 1979. Now, the reason why this is important is because we have a cap on Social Security, as you guys all know, at about $106,000 right now. In 1983, it was set at 90%, and as we've had more and more income inequality, we've had actually the same amount of workers who have income above the cap, but the amount of income that they are earning is much, much larger. So right now we are only taxing about 84% of that income. So one of the solutions that I would propose is raising the cap. And the reason, this is a slide to kind of one of the reasons I think is because the Social Security tax is already relatively progressive. This would lessen some of regressive. This would lessen some of the regressivity of the cap. There's one of the arguments against this is that the income inequality that people have experienced in the last couple decades has not accrued as much to those that are over the 106, but more the ones that are the richest of the rich. And I think this graph is important. This shows the 95th percentile, which is about the margin at which people who have some who are kind of a little above the cap. This shows their income inequality has, relative to the median households, has actually gone up by about 37%. So they have benefited very strongly from the last couple decades increasing inequality, and also and also the Social Security tax already is relatively regressive, as we can see here. So I think it makes sense that one of the big solutions that we should have is raising or eliminating the cap. If you bring it back up to 90%, then you get, I think, you solve about half of the problem. And if you eliminate it, then you've solved the entire Social Security shortfall. So with that, I will turn it over to Mark.
Mine just load automatically?
Oh, I don't know. Yeah, looks like it.
Thank you very much, Ethan. I also want to thank NASI for having me. I was actually a NASI intern a few years ago. It's a great experience, and I hope all of you are enjoying it. When Ethan and I got the invitation to debate here, we had just actually started working together on the Fiscal Commission, and it was interesting, and we were trying to figure out if we should do it or not, and Ethan's a great friend, a great colleague, so I didn't know if I wanted to embarrass him, but I decided I would anyway. So I'll just begin on that. I don't think anyone would disagree that Social Security is heading on a road towards insolvency. We're already in deficit. After about 2016, those deficits are going to start rising substantially to the point where eventually we would need either a benefit cut of about a quarter of all benefits or a tax increase of about a third of all taxes, or some combination of the two. But you know, we don't just have a Social Security problem. We have a public debt problem. Our country is on an unsustainable path and borrowing way more than we can afford. Right now, we're borrowing about 60% of GDP. Typically, we've borrowed 40. As you can see in this graph, by the end of the decade, we may be at 90 or 100, and it's just going to continue growing after that. Very few people, if anyone, believes that over the long run that's sustainable. So what's driving the debt? Well, as Ethan pointed out to you, Medicare, Medicaid, and other federal health costs are the primary driver, as you can see in that yellow bar. Social Security is increasing growth, and it's nowhere near as large as Medicare, but it's bigger than pretty much anything else. So it's a piece of the puzzle. And then there's the question of what is causing these entitlements: Medicare, Medicaid, Social Security. I don't think the exchange subsidies would necessarily fall into this category as much. But what's it causing these entitlements to grow? And there are two key factors. The first is excess healthcare cost growth, the fact that healthcare costs are constantly growing faster than the economy. The second is population aging. In the near term, and probably through 2050 or so, population aging, the fact that we're getting older because of both low fertility and an aging population, is the key driver. As we look out in the far later years, healthcare becomes a key driver, but both are very large drivers the whole time, so we should deal with both, obviously. But Social Security reform can't really deal with healthcare very much, and this is a Social Security forum. And population aging has other consequences. First of all, population aging slows economic growth. When the population is older, there's fewer workers, that means less labor, and there's fewer investors, because instead of saving their money and putting it in the market and in bonds, people are withdrawing their money from their retirement accounts. And so we have less labor and less capital stock, and those of you that have taken Econ 101 know that means a smaller economy. Secondly, as the population ages, there's greater risk of poverty for individuals at old age. That's mainly because you spend more years in retirement and therefore have a greater chance of outliving your savings. And then there's the fiscal insolvency question. I showed you what's going on with entitlement growth, but the fact that we have fewer workers also means that we have less taxpayers. And so in some sense, population aging is undermining the revenue base at the same time that it's driving up the cost of Social Security, Medicare, and to a lesser extent, Medicaid. Now, Ethan talked about the key to controlling those healthcare costs is healthcare reform, and he's right. But again, this is a Social Security forum, so let's focus on aging. You've probably have heard people talk about bending the healthcare cost curve, trying to figure out a way to make healthcare just not grow as quickly as it is. We can bend the aging curve. We can do it. Theoretically, there are lots of ways. Population aging, to back up for a second, basically depends on something called the dependency ratio, the amount of workers per retiree. Many of you may have heard that we're at about 3 to 1 now, and we're heading to about 2 to 1. So in this little stick figure world, 2 to 1 is the same as 6 to 3. But we can change that. One option, I don't know what policies you could undertake, is to change the demographics themselves. That could mean more fertility, that could be more immigration, or we could do death panels.
I was going to make that joke.
A second option is to make retirees less dependent. In other words, increase the amount that they're saving so that when they get to retirement, they can afford to live on the money they have. A third option is to make workers wealthier. If we can make workers richer, then the fact that they're having to pay more money to retirees won't be as big of a burden, and everyone could be better off if we could do this. And finally, we can change the equation. By getting people to work a bit longer, we can turn some retirees into workers, and that changes the whole concept of the dependency ratio, or the ratio itself, rather. If I was an economist, I would probably describe these options as increasing mortality, increasing fertility, and increasing immigration. I don't think we can really do much of those three with Social Security reform, nor would we necessarily want to. But then there's encouraging longer working lives and increasing national personal savings, both of which we can do with Social Security reform, and by the way, both of which should improve economic growth. So what are the benefits of later retirement? Well, there's lower Social Security costs for a given amount of benefit, or larger benefits for a given amount of cost. If people work longer, they're paying more payroll taxes and more income taxes, so we're getting more revenue. Retirees are having more years that they're saving, and so their wealth increases. They're having few years that they're relying on the saving, and so they don't have to stretch the money as far. And finally, as I explained, if we have more labor and we have more investment, we'll get stronger economic growth. And Social Security, has a lot of levers that can help us to encourage later retirement. One is the normal retirement age. Another is the early retirement age. Right now, they're at 66 and 62, with the former heading up to 67. We can increase and change those. There are other work incentive changes that we can do as well, and many of these have the side benefit of also improving solvency in the system. Ethan is probably going to point out that, well, some people can't work past 62. And he's right, but as a society, I don't know if you can read the text here, but this red line is life expectancy. I believe that's life expectancy at age 62, but I can't remember for sure. And the blue line is average retirement age. So as you can see, each year that life expectancy has gone up, we've retired earlier and earlier. Some portion of the population, I would say, most estimates say about a fifth, really can't work past age 62. But it doesn't necessarily make sense to protect the entire population to protect a fifth of the population. There's lots of ways that we can actually protect the people that we want to protect while encouraging the rest of them to work a little bit longer. The second way we can treat aging besides getting people to work longer is by increasing personal and national savings. If people have more money, that means they have greater personal retirement security because they have more money. It also, if we do something like a mandatory or voluntary add-on account, has the benefit of increasing the availability of safe and low-cost investments for lower and middle earners. It also means that we're pre-funding retirement more, so we can do some things now instead of waiting till later. And finally, if we increase savings, that means more investment, and so stronger economic growth. I'm going to skip through these. There are risks associated with investing, even in an add-on account. The one thing I would say is that stocks are more volatile than they are risky, and over a long period of time, if appropriately invested, we can take care of a lot of those issues. I'll come back to it in the questions if we want. But I'd like to close by saying that none of this, getting people to work longer, getting people to save more, lets us avoid making hard choices. I took a plan, basically a hypothetical plan, that would throw every single possible work incentive, even the ones that are actually benefit cuts, together. And it gets me to about 2/3 to 3/4 of the way towards solvency. And you would never do all of them together because they would hit the same people too many times. So at most, we're talking about half that we could get through things like raising the retirement age and changing other incentives. So that means we need to look at tax increases and benefit cuts, straight benefit cuts for the other half. If we could do mandatory add-on accounts where people are required to save more, my preference would be to do it all on the benefit side, which I heard from the earlier discussion is not where the rest of you are. There are two main reasons for that. The first is if we have mandatory add-on accounts, that really will replace much of the benefit that we would be cutting, and so people would probably be roughly held harmless. Although I do the benefit cuts for the higher earners especially, so it would be progressive. The second reason is I'm not an anti-tax guy in any way, but I've look at the debt situation, and I know that we're going to need to raise taxes a lot. And I also know that there's both an economic and political limit to how much we can. And so you have to ask yourself, do you want that money to go to Social Security, or do you want that limited amount of money where we have other options like getting people to work longer and getting people to save more, or do you want it to go to pay for health care where we don't really have those options? And I think that's a tough choice. And in the world without mandatory add-on accounts, I would say the first place to look is the payroll tax cap in the base. So I'd agree with Ethan on that, but we have to be careful and think about this in the entire fiscal and economic context. So, thanks.
and now I think this is the rebuttal portion. I need to have some more slides here. How do I get back?
Did you steal my slides?
No, you left them up here. Oh. Uh-oh. How do I get back to my slideshow? So yeah, with the rebuttal, we're kind of going back and forth here. So while I'm waiting, I'll say I'm not exactly sure, why we're taking immigration off the table.
Immigration is just not Social Security reform.
Well, I mean, as you saw from the previous slide, or one of the slides that I had, so Social Security immigration was one of the main drivers for actually the gap not being larger. It's about 0.7%, which is actually larger than the entire fiscal or Social Security gap that we face. So had it not been for larger than expected immigration in the last couple decades, then the Social Security gap would actually be about double of what we're at right now. So I think that immigration should definitely be part of not just the immigration debate, but certainly part of the Social Security debate as well. And one could argue that it is unpopular, but so are benefit cuts. Okay. The first thing I want to say is that I think that, and I don't want to take anything off the table, but there's a couple things when we're thinking about increasing the retirement age. There's a couple things we at least need to consider. I'm going to skip that one. Life expectancy is increasing, but it's increasing at different rates. For the top half of the earning distribution, there have been large increases in life expectancy life expectancy at age 65. So if you make it to 65, how much longer are you going to live? And for the top half, they have, it's been, I actually can't do math. That's what, 4 years. 5. That's embarrassing. It's about 5-year increase, but 1.1 years of increase just for the bottom half of the earnings distribution. So we should keep in mind that for those that rely the most on Social Security and are more likely to be in jobs where they can't work past 65, sometimes have difficulty just making it to 65, that we're asking that they will be taking an across-the-board benefit cut. And we should keep in mind that this is across-the-board benefit cut. That is what raising the retirement age means. It means that we are completely eliminating benefits for people between, if we raise it from 67 to 69, then we're completely eliminating benefits for 68-year-olds and 67-year-olds. So, yes. Yeah. So, the next point is that we assume that if we raise, I think the assumption that Mark makes, if we increase the retirement age, then we will get people to work longer. The analogy I think of is similar to unemployment insurance, where a lot of Republicans have recently argued that the solution to our unemployment problem is just eliminating unemployment benefits, because the reason that we have unemployment is because people don't want to work. And that they're being tempted by these benefits so they don't go back to work. I think that that's just completely misreading the labor market, and I think that this is misreading the elderly labor market. I think that the reason that they do not work longer is not because the benefits are so tempting. In fact, most elderly actually retire early, even though financial planners advocate against that. So obviously, it is not that the benefits are so generous that they are being pulled out of the labor market, is rather they are being pushed out, and they can no longer work. And there's a couple things I'd point out. There is rampant age discrimination. There was a Texas A&M study that 4,000 applicants said they sent out 4,000 applications, and the only thing different was the age, and found that older workers were less likely to receive 40% less likely to receive a response back. According to a McKinsey study, which you can see right here, about 40% of retirees are forced to retire earlier than they expected. And there's 3 reasons for that. One is health reasons, another is job loss or downsizing, and the third is need to care for spouse or family. The second one I think is interesting because oftentimes people think of age discrimination, but it's not exactly that. A lot of times if you are unemployed, you're going through structural shifts in the economy, and you try to get rehired, the employer is thinking, am I really going to spend, invest a lot of money in a new employee who is only going to be around for a couple of years and then is going to retire anyways? So they will probably pick the younger worker because they can get a greater return on their investment. I'm not sure if that's necessarily age discrimination. It might be on the individual level, but in the aggregate, I think that it is, well, okay. But what I'm saying is that overall, it is not necessarily good for the economy. It's not necessarily good for the economy if we are for forcing people to try to go back to work, even when, from an economic efficiency standpoint, people at the margins are thinking that I want to invest in someone who is going to be, employed for me longer. The third thing is that, even if they are, where did I have that point? My time's up. Okay, I'll go with that.
I'm not going to use up 2 minutes to try to figure out how to use the PowerPoint, so I'll just proceed without it. Yeah, that's right. Went there. I think I lost the crowd.
You should fix your tie, too. I don't know if it's...
Ethan actually helped me put on my tie this morning.
Not supposed to say that.
So very quickly on immigration, we should be doing immigration reform. Doesn't really make sense in the context of Social Security reform. And one thing I would say is that right now, illegal immigrants pay into Social Security but don't get out of it. So they're actually a boon for the system. Just immigration reform, which put gave them a path to citizenship, probably wouldn't help Social Security at all. I'm totally for more immigration, but it's not really a Social Security issue directly, which is why I took it off the table there. Secondly, I guess everything else here is about the retirement age, so that's what I'll focus on. Ethan's right that we haven't all had increased our longevity at the same pace. Those of us who tend to be in the lower end of the income scale have seen only modest increases in their life expectancy, where those at the top have seen big ones. But the way to deal with that is to make the rest of the system, and frankly the rest of the tax code, more progressive, and to protect them in other ways, not to take this off the table. Because on average, life expectancy has gone way up. You worry that people can't work past 62, but we were working until 75, if you saw my other graph. We used to retire way later. When we put Social Security in place, and we put the retirement age at 65, the average retirement age became 65. Once we implemented the early retirement age of 62, I guess anyone here could probably guess what the average retirement age is. Most people retire at 62, and when you look at the surveys, they had intended to retire at 65. And when you ask them, why didn't you? Most of the reasons just aren't very good. Now, some people have health issues and are job attachments, but a lot of the survey answers are, well, my firm hired a young guy, and he's threatening, or they changed the way they're doing things. The unfortunate fact is people aren't necessarily totally rational actors, and when they have that escape valve, they use it. Now, some people legitimately need to use it. Some people actually retire before 62 and just can't collect benefits till 62. But I'd say the fact that the average retirement age has gone down so quickly and has gone to exactly where you're able to collect Social Security benefits is a pretty strong piece of proof that that is a driver of when people retire. But we do have to worry about raising the normal retirement age and not touching the early retirement age, because the effect of, say, raising the normal retirement age to 70 and leaving the early retirement age the same means that essentially everyone who retires at 62 is going to get a huge benefit cut, because there's an adjustment downward for every year you retire before the early retirement age. And so I think that's something we need to be very concerned about and very cognizant of, which is why I've become such a big proponent of raising the early retirement age as well. There could be some protections. Some people say strengthen the disability system. I would have a super special early retirement age for people that need it. Ethan doesn't really like that name. Or the idea. Another option is to let people collect some portion of their benefits early, but not all of it. Another option is to have a big benefit up front that claws back over time, so that when you get to, say, age 80, where you really don't have the option to go back to work and where your savings is starting to be exhausted or has been, you would get the full benefit. There's lots of ways to protect the people that need it, but still encourage us as a total economy to work more, pay more in income taxes, do more to promote economic growth, and therefore help solve this aging issue, not just for Social Security, but in the context of our entire debt and fiscal situation.
I'd like to invite those of you with questions to please get the attention of one of the individuals standing with the wireless microphones. Please identify yourself and your organization. And please try to keep your question brief so we can fit in as many people as possible. And with that, I'm actually going to open with the first question. And it's directed at Marc. Marc, you were very insistent on separating immigration from Social Security. But in the second page of your slide, you have a graph, a graph that says caused by growing entitlement costs, which refers to the debt. And I think if we're looking at Social Security individually, then we need to acknowledge that putting it together on a graph that contributes to the national debt, well, isn't it true that Social Security, we cannot borrow to pay for Social Security benefits by law, and thus it does not contribute to the debt in the same way that the other programs lumped together on that graph do?
Sure. There are two separate issues. The one is the Social Security Trust Fund issue, and the one is the issue of what economists call debt held by the public. Social Security, when it runs surpluses, which we did not do intentionally in '83, collects money in a trust fund, and that money collects interest. Essentially, what that money does is change the unified budget deficit by investing that money in treasuries. And so essentially, the government as a whole now owes money to the Social Security Trust Fund, which is one way of saying that my left hand owes money to my right hand. But it does. And so in that context, Social Security does not have to make any benefit cuts or tax increases until the point that its trust fund is exhausted, which is 2037 right now, or 2036. But there's a separate issue of debt held by the public. And when Social Security runs a deficit, it contributes to debt held by the public. And that's what most economists think is the primary measure of our fiscal situation.
So, I'm sorry, so just so I understand what you're saying, when you say it's running it, you include it drawing on its trust fund as running a deficit?
When Social Security runs a cash flow deficit, meaning when Social Security pays out more in benefits than it brings in taxes, by definition, it is adding to debt held by the public. When it raises more taxes than it pays in benefits, it's subtracting from debt held by the public.
That's if you consider trust fund borrowing, right? Or
no, it doesn't. It doesn't matter. Debt held by the public is a measure for which that doesn't matter. We could argue over if that's the right measure, but I think Ethan would agree with me that it is.
Thank you.
Yeah. No, I think I would agree on that.
Anyone? Anyone else? Yes.
Hello. Okay, there we go. So my question goes, I guess, to Eric. It's specific. Ethan. I don't.
It's okay.
Ethan. This is about the age discrimination point. This is something that I've been very sort of aware of as my father gets pushed out of first the federal government, and then now he's getting pushed out of the private contracting business, which took over his work from before. My understanding of increasing the length of the lifespan of working is that what will end up happening is that it will just increase age discrimination. And is there any data to show otherwise?
No, I mean, I believe you that I think that will I think that'll be the case, that you'll have at least more claims of it. I mean, I know that there is a argument that, as you know, in theory, if there's more elderly in the workforce, then there will be less discrimination against them because there will be less of a minority. I just don't really buy that. Because I think that a lot of the age discrimination is not happening just because they are a minority, but in part because of for the managers, somewhat rational decisions that are yet at the same time still certainly qualify as legal age discrimination. I think that a major just difference between Marc and I is that I think that Marc perceives the point at which someone retiring is that they are, again, being drawn out of the labor market because of benefits, and if we only deprive them of those benefits, then they will keep working, where I do believe that the elderly are facing significant challenges in the labor market, and that what you will see if you raise the retirement age is just more unemployed elderly people who are no longer able to collect benefits.
Yes.
Is it working? Oh, there we go. Okay. Hi, my name is Ann Kelt. I'm a NASI intern. I just had a question about sort of related, I guess, about raising the retirement age. We're talking a lot about ageism, which I definitely think is an issue, and also about, people not being able to work past the age of like 62 or something similar. What about the people who are, getting paid, are like secure in well-paid jobs, who could easily work, past 65 and can work to 70. And then when they continue to work past the Social Security retirement age, I believe are getting some sort of enhanced benefit. So is there any sort of solution you see as far as like possibly raising the retirement age for the people who are able to work and to make some sort of exception for people maybe who are in more manual labor jobs who would have to retire earlier?
First of all, yes, I think we're smart enough as policymakers. We're not going to get it all right, but I think we can put protections in place. I don't know if it was one of your NASI options, but I heard a lot of people talking about separating out blue-collar and white-collar workers. There's some things we can do, occupational-specific things or conditional-specific things on that. On the delayed retirement credit, that's supposed to be an incentive for people to work longer. It's not very strong. One reason being that very few people actually make it to the normal retirement age in the first place. And the second being it seems kind of small. One option I've always thought was interesting is maybe turning that credit into a one-time bonus or half of it into a one-time bonus. I think that would help a little the incentives. I also think that if we're going to try to get people to work longer, we can't just do it in Social Security. The federal government sends all sorts of mixed signals to its employees, and obviously the place to start would be with its own policy, but we should be making regulatory changes to 401k and IRA and pension rules, discrimination rule changes. And I'm becoming increasingly of the belief that we can now raise the Medicare retirement age because health reform now has both limits on how much you can charge older people for insurance and in exchange with subsidies. So I think that raising the Medicare retirement age would have a progressive outcome where the poorest would go to Medicaid, the next group would go into an exchange with generous subsidies, and so on, just like we do with the rest of the system. So I think we can look there also.
I'm just very skeptical that, and I know the idea that you broached was very similar to what Mark has advocated, which is I think the super special retirement age. Essentially, if I understand it correctly, it would be similar to disability, where there would be a certain process you have to apply for this this super special retirement age, and then I will keep repeating it as much as I can. And you apply for this and go through a certain legal proceeding, and then a decision is made. I think that it relies very heavily on a process which already for disability is fraught with problems. Disability proceedings tend to be very arbitrary, and it is very difficult for an entire system which has tens of millions of beneficiaries to decide who is and who isn't okay to be retiring early, and it is likely that you're going to have to vastly increase the overall. Right now, Social Security is a very efficiently run program with relatively low overheads, and you're going to have to vastly increase that. It's going to be a very complex and bureaucratic system, and there's going to be. I think really the question is: are you more worried about people who don't? Might not need the benefits to survive getting the benefits, or are you more worried about people who do need the benefits to survive not getting them? And my concern is more with the latter than the former.
Do you mind if I?
Yeah.
We just keep moving along.
How many questions do we have more? Okay. Then I think we probably have a time for a short response to the response.
I would say my two concerns are, one, our fiscal and economic state, and two, protecting people that cannot protect themselves. And that means mainly the old. The point of Social Security is to protect people against outliving their own means to protect themselves. It's an insurance program. And so the focus needs to be on people that are of lower income and people that are, pick your age. But I'd like to, one option to get at that is something called old age risk sharing, which you wouldn't increase the early retirement age, but what you would do is you would have a very sharp benefit cut in the first year. that could be progressive. So if you're lower income, it's not as sharp, and if you're higher income, it's sharper. And then over time, it claws back. And so say by the age 85, you're getting 100% of your benefit. And that's the time that you really can't go back into the labor force, that you don't have a lot of savings. That's the time you need it most. With a limited amount of resources, we need to put them where they're most needed.
Really quick, I think that there's a slight methodological mistake there where you you said that the implication was that this won't you're more worried with the old and not as much with the very new retirees, except for the fact that a new retiree will eventually become old. Not all of them,
their
but
benefit increases.
Sure, but okay, fine.
Okay, do we have any more questions here? Thank you. Go ahead.
This time it's on. I would be interested in hearing both of your opinions on the effect of how the Social Security Administration presents claiming ages, the fact that they present those about to make this decision with the age of 62 first, and how the break-even analysis influences the decision for when people decide to claim, and if you see any solutions for that.
I don't know enough about the intricacies of disability policy to have a good answer for that.
Neither do I.
Any more questions? Someone have a mic?
This is less of a policy question, more of a political question. Because of your guys' both recent work, how, in your own personal opinions, how do you connect or disconnect Social Security and the deficit?
I think that's a great question, and that's a big philosophical difference between a lot of people. Budgetarily, we've always treated Social Security's surpluses as reducing the deficit, and now we're counting its deficits as increasing the deficit, and it adds to debt held by the public when it's in deficit. So economically, you have to think of it as part of it. But Social Security is also its own system with its own trust fund, and that's less an economic issue and more a fairness and design issue. The one thing I will say is, I've kind of gone through a million combinations of plans, and I think on plans where there's potential political consensus at all, you don't come to that different results depending on how you think about it at this point.
I think that I agree with Mark that we should be looking at debt held by the public, and in that case, when there's a cash flow shortfall, and it's drawing from the trust fund, then it is contributing to the overall debt held by the public. That said, in terms of solutions, I think we do need to take into account the fact that there is a trust fund that is built up, and we should not start saying, oh my God, Social Security is going to start drawing from the general fund, in next 5-10 years, and thus Social Security is the problem. Social Security has built up these surpluses just for this reason. And in the near term, when we're talking about that near-term solution, the problem is not that Social Security is running a cash flow shortfall. The problem is that the general fund has been borrowing from Social Security for so long. It's similar to me, lending Mark $100. And then, or Mark asking me, can I borrow $100? I give him that, and then when I don't have any money, then I come to him, and he says, "Well, you shouldn't have lent me the money," which he actually has done. So,
I promise I will pay you back.
I just had one question personally for Mark. You mentioned, and obviously it'll be addressed by both of you, you mentioned making eligibility for certain kinds of benefits or targeted benefit cuts based on the income ladder. And we know, though, that something more than 60% of retirees, just to take one of the groups that benefits from Social Security, for them, Social Security is more than the majority of their income. how do you do targeted benefit cuts that have a real impact without dipping into that middle class bracket? And then politically, how do you do that without it turning into a welfare program that is always unpopular?
The proposal that I explained to you is one by a man named Jed Graham called Old Age Risk Sharing. And what I would say is, if we're going to do benefit cuts somewhere, and I think we do, I'd rather do it to people, one, who will be hurt the least, and that's going to roughly correlate to their lifetime income, and two, to people who do have the option, for the most part, to work longer or have more savings. And so that means people that are of lower income and people that, that means people that have higher income and people that are young, and I think 62 is young, will have to work more. I just want to, as an aside to the last question, make sure that everyone understands that these are Ethan's and I's own opinions and not in any way how the commission feels.
So, I mean, can you give me like a salary bracket at which you think that these would start? Because I think that's important for people to know when taking this into account, like a retirement income for retirees making 40,000 and up, or because some of the, well, yeah.
Well, the old age risk sharing isn't my plan, and he cuts everyone. He just cuts them by different amounts, and then lets them all get back to where they used to be. You know, if we're thinking about a different type of reform where we do something like progressive benefit cuts, I think it depends on the rest of the package, but I try to hold the bottom third or the bottom half as close to harmless as possible.
I think one of the one of the drivers of the enduring popularity of Social Security is that while it is progressive, even though the tax portion is regressive, the benefit portion is more progressive than the tax portion is regressive. Either way, it is seen as social insurance, it is seen as something that everyone contributes to and everyone benefits from. And the more we go down the path of means testing in order to kind of solve the problems in the next couple decades, the more it opens itself up to being considered welfare. And I know that, for example, we had a public hearing for the commission, and Heritage Foundation released their kind of solutions, and one was /welfare. Well, they were calling welfare anything that is means tested. So this included Medicaid, food stamps, et cetera. If we do more means testing of Social Security, eventually that will be on the chopping block as well. That will be considered welfare, and all of a sudden that will be, again, something that I think that will put, at least politically, that will put Social Security in danger. That's not necessarily a policy argument. I understand that, but it matters.
I think it's worth noting that the person from Heritage did mention cutting out welfare, and there was a lot of laughter in the room. So I don't think that necessarily the fact that he brought it up means that it's going to happen. I also don't think
but that will be the argument.
I also don't think that we should means test Social Security. I just think that when you have a number of resources, we should focus the most on the people that need it the most, and that's lower income. And we already do that. The question is, how much more do we want to do it?
Exactly.
Just to clarify, you talked about an add-on account as a way of comping for this targeted cut. Would that be invested in United States Treasury bonds backed by the full faith and credit of the United States government, those add-on accounts?
I would say that add-on accounts should default into a life cycle fund, and you can do like thrift savings plan style where people have 4 or 5 choices of where to put them.
With the bonds included?
The bonds are real assets. I'm not disagreeing with you that bonds are real assets, but when you're measuring debt held by the public, you're netting the bonds that we owe on the one hand versus the bonds that we own on the other, and they net out to 0.
Yeah, I was just talking about the risk factor. But yeah. Any more? Well, I think we have time for one last question.
I'm just wondering if politically you think the commission's actually going to come to a report or something that enough of the members can agree on that it's not blocked as part of the commission?
I'd say we're definitely going to come to something. What that is a little more uncertain. There are a lot of, when people ask me how I like my job on the commission, some days are really exciting, and I think that all 18 people are going to agree, and some days are a huge fight. So I tell them that I really need mood stabilizers for this job. I think we have a shot. I think there's a lot of agreement, broad agreement in a lot of areas. I think people that we didn't necessarily, or that I didn't necessarily expect, could be working together or working together. But it's going to be a tough negotiation. We have a big task ahead of us.
Okay, thank you. That's all the time we have for questions. A big round of applause for our presenters.